Hey everyone, it's Dr. K. So it may seem odd to think that your nagging leg or calf or foot pain is related to your low back, but it could be a problem. If you've had pain in your leg or foot, it could be coming from a pinched nerve in your low back that's actually creating the issue. So pain that travels along the spinal nerve is called radicular pain. And it's usually one of the most common types of pain that occurs as a result of spinal nerve compression. So usually I see this in an acute setting, like a brand new injury, but it can be a chronic problem as well. So, if we think about your spinal nerves, they can be pinched or they can be stretched or compressed by either the bone, disc, or ligament. So if this is your vertebra, you have two vertebrae and a disc in between. Your spinal nerve root hangs out around here, this opening over here. And basically any of those things can, pinch or irritate that nerve root, but it doesn't necessarily mean you need drugs or surgery to feel better and get back to the things you love. Now, bone spurs can come from a result of joint damage or wear and tear called osteoarthritis. It basically means that the bones can sometimes grow little spurs along that stress that start to create nerve root irritation. Now, disc herniations are acute. Disc bulges are chronic, and both can invade the space around your nerves and cause inflammation and pressure. So that disc can become deformed by a new injury or old wear and tear that starts to cause pressure. Now, ligament hypertrophy can happen anywhere with age and injuries, and they lead to added stress and pressure on your nerves. So the ligaments give support in the front, back, and the sides, and with overgrowth, they can become problematic. Now, with the right plan in place, you can still have an active lifestyle, and again, you don't need medications, injections, and surgery. My pain to performance packages, they take a full body approach that are specific to your goals and story. So you don't have to get scared that you can't live an active lifestyle. You don't have to keep doing the same thing over and over again, hoping that your pain's going to get better. If someone tells you there's a bone out of place causing your problem, do yourself a favor, turn around, leave right away. That's called a dislocation. And if it was true, it would require an emergency care situation to begin with, okay? Either way, if you're having those kinds of symptoms, your body's telling you to pay attention inside right now. Don't ignore it. Get a plan in place. Every day in my practice, I help people treat compressed nerves and get back to the things they love with the people they love. Reducing inflammation, establishing proper joint motion, getting a home mobilization and recovery plan in place means that my clients are being proactive and not reactive. They're taking steps every day to reduce the likelihood that their pain's going to come back. And this training is all part of my care plans. I want you to take a hard look at yourself and think about if any of those things are missing in your own life. Those are big steps to success. I'm celebrating your success already. Stay strong, inspire others.